Samvaad, a dialogue series. We have come together today on Zoom to deliberate the governance of healthcare with a special emphasis on one question: where to prioritize our efforts, strengthening public systems or in privatizing healthcare? This is part of an ongoing dialogue series organized by us, the alumni of Barefoot Academy of Governance. Barefoot Academy of Governance, in collaboration with Tata Institute of Social Sciences, offers a one-year postgraduate diploma in facilitating governance reform. As students, we get to learn what governance is, ab initio, from the first principles. With a strategic mixture of conceptual and experiential learnings, we study sequentially and in depth the four concepts: governance, dignity, democracy, and development. So, without much further ado, I invite my colleague Romila to begin the proceedings.
Yeah, thank you, Dushyant. Good evening to all of you. I'm Romila from Hyderabad. I'm currently a student of PG Diploma course in Facilitating Governance Reform. From the last year of joining this course, I have been able to see a number of changes in myself. One of the most prominent is the sense of awareness about various socio-political issues around me from the point of view of good governance or ethical governance. We have explored governance, dignity, and development so far, and the interrelatedness amongst the three. Through this course, I have come to understand that different structures, social, economic, cultural, political, and systems together affect us both individually and as communities. They determine not just where we stay and live, but also our opportunities, our access to resources, our choices, both in personal and political spheres. Looking at the current situation, we can see in the way this pandemic has exploded all the fault lines caused by structural inequality, systemic discrimination, and individualized disempowerment amongst people. While some of us are privileged enough to have a separate room for self-isolation, many of us are struggling to get even an entry into the hospital. While some of us can afford to pay 50,000 a day to get the best of treatments, many of our fellow citizens have lost lives unable to pay liquid cash and heavy caution deposits at the private hospitals. This makes me wonder, what kind of a society are we becoming? Is it money before life? What name do we give to this kind of governance that we are seeing? On what ethical framework is it based on? Does this framework violate any of our constitutional values and rights? If it does, who pays the price? Whose dignity is protected and whose is being compromised in this whole process? On this note, I would like to start off with a short introduction to today's meeting on the topic COVID crisis, strengthening public systems or privatizing healthcare. Which path do we take? Next slide. Thousands of fellow citizens, friends, and members of families have died due to lack of medical facilities and non-availability of oxygen at critical times. A crucial question is, why did this happen? Was this inevitable, or is it due to the carelessness of our government? Oxygen generation units, instead of increasing, got decreased and are now sold at high prices on the black market. The same is true about medicines, drugs, hospitals, and medical equipment. Profiteering during this crisis seems to be the norm. The government and other monitoring agencies suddenly appear to have gone blind to this. In the past 73 years, the government of India had been supplying vaccines and medicines for infectious diseases free to the states under national program. But surprisingly, now it has asked the states to buy vaccines for themselves at a price which shall be determined by business companies and the market. We are witnessing the deadly result of the policy of privatization. Our healthcare system not only failed to deliver to all citizens at all levels, but also the government tried to ridicule the situation by politicizing the vaccination, promising free vaccines in exchange for votes. People's lives have become a joke. Adding to this, the 50 lakh health insurance scheme that was provided to all the health workers lapsed from March 24, 2021. On the other hand, Private hospitals are charging close to 2 lakhs a day for the treatment. Even though care for all who need it was promised by our government, regardless of income, treatment is as unequal as the inequality in the country itself. Care ranges from crowded wards at public hospitals that many people are scared to even enter, to spacious rooms at private hospitals that only the wealthy can afford. Next slide. This is an image from Patna. Pranay, who's a caretaker of his ill mother, ran from pharmacy to pharmacy in frantic search of remdesivir. He finally found one, and the pharmacist told him to shell 1 lakh rupees, which is 30 times its usual price, 20 times the average monthly salary for any Indian blue collar worker. In Lucknow, Ahmed Abbas was charged 45,000 rupees for a 46-liter oxygen cylinder, 9 times its normal price. Similar scenes are unfolding across the country, with desperate people taking to social media to beg for beds, oxygen, or medication. But the irony never ends. Instead of taking action against the hoarders and black marketers, the Chief Minister of UP has declared that anyone found talking of oxygen or medicine shortage in UP will be arrested, and some people are reported to have been prosecuted. Today, social media offers a universal communication platform to reach out for help in finding medicines and oxygen supplies. Intolerant governments want to criminalize social media outreach. We are living in such a bizarre situation. Let's take a moment to think about the state of the healthcare system and health policy in the country. Even before COVID struck, the public health system was crumbling and failing for the lack of government support. In contrast, we have an example of the Kerala government, which has shown a ray of hope that it is possible for any state to take a proactive approach and systematically strengthen their health infrastructure by establishing at least 2 COVID hospitals in each district. They have surplus oxygen right now, which they are supplying to other states. Kerala is a state that has shown us what a welfare-centered government would look like. A global example of a people-centered, welfare-oriented health program is the National Health Service Program of UK. Amongst us, we have a friend of ours, Mr. Jasjeet Singh, joining us from Stockport, UK, to share with us the difference NHS made to him recently during a personal tragedy. Jasjeet is a principal consultant with DNV, a risks and safety specialist with experience across hydrocarbons and chemical industry, electric propulsion systems and renewables. I now invite Jasjeet to share with us his experience.
Hi, good evening, everyone. I hope you can hear me okay.
Yes.
Yeah.
Okay. Thank you very much to the organization team and especially Simran for inviting me to share some thoughts with you all. It is a privilege. And firstly, the situation currently in India, I've seen the scenes on news, and it is heartbreaking. And every effort anybody is making to mitigate the impact is worth it. And I would send my best regards and best wishes to everyone involved in that effort. And I hope that in coming few weeks, the situation will come under control. Any loss of life is horrid, and loss of life at this scale is a crisis which I haven't seen in my lifetime so far. Now, Simran is actually my cousin, and he knows what happened recently. And for some reason, he thought it might be useful to share my experience with the team here. Now, the UK has the National Health Service, which is a sort of a centralized health program. which is trust-based, managed by the central government in the UK, but it's also implemented locally. So it's not completely government funded, but predominantly government funded. It also operates as a charity, and it not only provides healthcare, basic healthcare, it covers all aspects of healthcare, and also education in medicine and in nursing. So it's a very, very vast enterprise. Probably the closest thing to religion we have in the UK is the NHS. It's highly loved, and no one in this country will ever question the positive impact NHS has had on everyone here. Now, at beginning of April, unfortunately, I was involved in a collision while riding my motorbike, which could have turned out to be a fatal one. But from the moment the incident happened to right now, the care provided by the NHS has been nothing short of a miracle, to be honest. To give you a very brief timeline of what happened, within minutes of the impact, the paramedics were at the scene. They recognized that the injuries were a bit too severe to be treated in any local hospital, and they called air ambulance. Within 15 minutes, the air ambulance was hovering over me, and I think within half an hour or so, I was airlifted to a specialist trauma center where I was treated. Within a couple of days, I had both my arms operated with the internal fixation, and also my leg with some open reduction internal fixation. These type of surgeries in India, I've heard, would cost several times a normal person's average salary, and they're not really affordable. Now, the beauty of NHS is that healthcare is available to each and every person here, irrespective of their socio-economic background. It does not matter who you are, where you come from, what you do. It's immaterial. It's the life comes before anything else. So the moment you need doctors to come and help you, NHS takes care of all aspects of it. And on top of that, you don't have to spend a penny. So whether you're a very rich person or whether you're somebody on benefits living under the poverty line, or whether you're somebody who just happens to be visiting the country, you will get the best possible healthcare. Life comes before anything else. And this is the reason why I'm here. You know, without the NHS, I would not be speaking to you today. So for me, they are, you know, God. You know, I'm not a very religious person, but if there's anything close to a concept of God, I think NHS will come pretty close to that. Now, this issue of private versus a government-run effectively healthcare, you only have to look at the pan-European models, whether that's NHS in the UK. I've worked in several European countries. I've spent last 3 odd years working in Switzerland, and they have a similar system as well. The model might be slightly different, and the way you pay for it might be slightly different, but at the end of the whole thing is a highly efficient, highly capable system, which is available to everyone. So healthcare is not a privilege of the few. where you're born does not determine the level of care you'll get, which unfortunately seems to be the case in India, where if you're a rich person, you can afford pretty good healthcare. And if you happen to be a poor person living below the poverty line or hovering somewhere around it, your options are very limited. Now, my opinion on this thing is that, you know, healthcare is a fundamental right, and it is quite hard to talk about a middle ground when something that is a fundamental right is being discussed. Basic healthcare should be available to everyone, irrespective of their background. Full stop. The issue with the privatization of the healthcare system is that by nature of these institutions, they are run for profit, and any profit-making organization will not be able to deliver the same level of care to everyone, and we have seen that in several places. Healthcare is not a profit maximizing industry. It does not work as a free market, and if we try to force that model, especially in a country like India, it is bound to fail, in my humble opinion. Reason being that, as the previous speaker mentioned, you have seen that in times of crisis, profiteering from misery of your fellow citizens, unfortunately, is quite common, and I don't see a way out of that. So, privatization is probably not a solution for India or for anybody else, to be honest. So, having experienced NHS and what it can do personally, not only in my case, but I have two kids, both were born in emergency C-section, and all these events have costed me nothing, and we got the best care possible. If I was in States, I'll be in debt for life. I would have lost my house. I would have lost everything. If I was in India, I'll probably be dead now, with the videos of me circulating on Facebooks and such platforms. So I cannot stress any more that an institution such as NHS is probably the best thing, the most humanitarian act committed in peacetime.
True, Jasjit. I totally agree with you. A structure is necessary. How we structure is something which we are waiting for Dr. Shukla to speak on. But we are very happy to have you here. Happy that the incident is behind, and you are hail and hearty to join us today. I welcome Dr. Abhay Shukla.
Hello. Hello, thank you. Should I start now? Okay.
Yes, sir. Yes.
Yeah.
Okay. So I'll can you see the presentation?
Yes, sir. We can.
Okay. So I changed the topic a little bit because I felt that in the period of the COVID pandemic, of course, I'll be referring to public health system and private healthcare sector, but rather than talking about that in a generic way, I'll be actually talking about what has happened in terms of governance or lack of governance during the COVID-19 epidemic in India, which I think you will find perhaps more relevant as all students and practitioners of the area of governance. And I've called it a saga of misgovernance, But in my humble opinion, what we are seeing today across India is criminal misgovernance. You might disagree with me, but we can have a discussion about that. But I will substantiate this with a number of facts. What we are witnessing today in India is a catastrophe of unprecedented severity and dimensions. There are no words to describe what is going on in many cities and towns and also rural areas across India. And now we know that there are cremation grounds where there is no space because they are burning day and night. And the second wave has proved to be much worse than the first wave. It could have been anticipated, but it was not. And this figure, I suppose you can make out what that figure is. That is the counter as of today of deaths due to COVID. And this is a huge underestimate, a huge underestimate. Many more than these 2 lakh people who have been recorded have died so far, and the deaths are rising every day. So what went wrong and what could have been done and what actually happened? In the first wave of COVID-19, on 30th of January 2020, WHO declared COVID as a global public health emergency. And immediately the government of India should have closed all international airports, or even if people are allowed in, they should have been intensively screened for screened for COVID-19, and they should have been treated, isolated. Their contacts should have been traced and tested and quarantined. And this was not done nationally, and many states. Kerala was an exception, which did many of these things and largely contained the infection for a long time in the initial period. But this was a big failure by the national government. What was our Honorable Prime Minister doing in February and March? So in February, he was busy in welcoming Mr. Donald Trump, an honorable gentleman who all you know about. You may have some interesting opinions about him also. I definitely have. So he was being entertained and a gathering of more than 1 lakh people in Ahmedabad. And you know what super spreader events have been. So this is one of the first super spreader events. So when WHO was talking about a global public health emergency, it was well known by mid-February that COVID is increasing. This is what was being done by our Prime Minister. What was he doing in March? In March, when the WHO had on 11th of March declared COVID as a global pandemic, I mean, there cannot be a stronger term in the vocabulary of the World Health Organization. On 13th of March, our Prime Minister said there is no health emergency. And obviously, because there was another emergency, the need to topple the Madhya Pradesh government, which went on until 20th of March. So there's no attention to the COVID epidemic, at least politically at the highest levels. And then suddenly after 20th of March, our government at the national level woke up. On 22nd March, there was a Janta curfew, and on 24th March, with just 4 hours of notice, despite the fact that there was a very variable picture of the epidemic at that time across the country, as you probably know, there were some cities and some specific areas where there were cases, but the vast majority of districts and towns had not only no cases, but also a very little likelihood of import of cases. But the entire country was locked down at 4 hours notice. So complete inaction followed by completely draconian action. And then, of course, our Prime Minister declared that the war against COVID, like Mahabharata was won in 18 days, this will be won in 21 days. Now, I don't know if anybody goes back and asks politicians what they talk about, but somebody should ask this question. Now, after that, after the middle of the first wave, and there are many points in the first wave also which we can discuss, but we have limited time. But we are more concerned right now about the second wave. Now, what needed to be done by the middle of the first wave was the need to majorly increase the number of public hospital beds for ongoing and anticipated COVID patients. And actually the lockdown, the justification was that additional public health facilities and also to some extent in-source private health facilities can be arranged so that, if the curve is flattened and instead of having a very sudden high peak, we have a gradual curve, then people can be cared for And, however, the government hardly increased public hospital beds in any state, and definitely not at the national level. For your information, India has one government doctor for 11,000 people. WHO norm is that there should be one doctor for 1,000 people. So we are just a factor of 11 times less than what is required. India has about half a government hospital bed for 1,000 population. Of course, we have more private hospital beds, but the WHO norm is 3 per 1,000. And Bihar, as one state, as an example, has 1/10 of a government hospital bed for 1,000 population. So you can imagine this is the starting point. So we actually had a huge backlog, and the COVID epidemic should have been a wake-up call for governments at the national level and across states to rapidly expand public health services, but nothing of the kind was done. This is the second major failure. And historically, India has among the lowest levels of public health spending in the world. Now, Jasjeet talked about the NHS, and the reason why NHS, as a wonderful example, is possible is because the United Kingdom spends nearly 10% of its GDP on health. Our country spends a little more than 1%. And if you see the per capita public health spending, I mean, Cuba is a complete outlier, but even if you look at China or Malaysia or Thailand, they spend something like $200 to $250 per year. This is government health spending. Even Bhutan, Sri Lanka, who are our immediate neighbors, they also spend something like $70, and India spends less than $20. The average for Southeast Asia is $120. The average for Africa is $60. We are nowhere even in the league. So, this is the level of criminal neglect of public health that we have in this country. So then, what should we have seen in this year's budget? So we saw headlines saying, "Oh, the government is increasing health spending. The government has declared a 137% increase in the health budget." So many people who did not go into the finer details thought, at last something has happened, but actually it was a huge deception. I'm sorry to say this. Such a learned person in such a position of power. Actually, what happened was that the health budget suddenly, for the first time in Indian history, was made into the health and well-being budget. We don't know what that means exactly. And the plan for privatization of drinking water and handing over large-scale public funds to private, water providers, that was lumped with the health budget suddenly. And it was said that, there's a huge increase in the health budget. Actually, there was nothing of the kind. This year's health budget, which is about 76,900 crores, is actually a decline of 11% from the previous year's revised estimate of 85,000 crores. And just 2.2% of the total budget of the at the national level. So despite all of this, despite the entire experience of the first wave in 2020, in February 2021, we come out with a budget which is actually a complete non-starter. And so how will we get public health expansion? And the last point here is that there's only one increase, which is the allocation of 35,000 crores for the COVID vaccine. But as we will see, even this amount is not being spent as required. Now, what about private hospitals and doctors? In India, 80% of doctors, 90% of specialists are in the private sector. 70% of healthcare utilization is in the private sector. So it's obviously dominant. However, despite an act being passed in 2010 called the Clinical Establishments Act at the national level, till date, there is no effective regulation over the costs, quality of care, treatment practices of private hospitals. 1 decade has passed. So the same government which rams through, even without going to parliament, it rams through, ordinances to modify the, rehabilitation law on land acquisition, which, doesn't wait for even a few months when it needs to, pass laws for its own liking. It has waited 10 years and has still not managed to regulate the private sector. Now, what happened in the COVID epidemic? Many private hospitals and clinics, they initially closed down And later on, when they opened, especially larger and corporate hospitals, as already mentioned by our friend who introduced the session, they started overcharging at a massive scale. And we have been receiving instances of 15 lakhs, 20 lakhs, 25 lakhs being charged, including in cases of patients who have died of COVID by private hospitals. And of course, some state governments have tried to regulate rates for COVID care, but it's a bit like trying to bolt the stable after the horses run away. So, it is not worked very well, but at least, it shows that governments have perhaps woken up to the fact that private hospitals do need to be regulated. Now, one example of a state level Jan Sunwai on patients' experiences. Like it's a public hearing on private hospitals. I'm sure you would not have heard of too many such incidents. Jan Arogya Abhiyan, the People's Health Movement in Maharashtra, organized a hybrid, because of the COVID situation, we had to do it hybrid, a public hearing, and where 130 people participated. We got more than 100 complaints of, patients regarding overcharging, violation of government regulations during the COVID epidemic, denial of free care under the very famous Pradhan Mantri Jan Arogya Yojana, which was supposed to be a huge game changer, which has proved to be a complete flop in the COVID epidemic, etc., etc. Now, I'm mentioning this public hearing because it has shown us how severe is how major exploitation of patients takes place in private hospitals. Not just one or two instances, but hundreds more would have also probably come. And this tells us how regulation is a heavily overdue and important agenda. Now let's come to the second wave, which is very interesting. And we know, unfortunately, what is going on. Global epidemiological evidence showed us that a second wave was quite likely. We had predictions showing that maybe not at this level, but there is going to be a second wave. So countries like US and Europe did have a second wave in various forms. Countries like Vietnam, South Korea, New Zealand, Japan, they avoided a second wave just because they took a wide range of very stringent measures. So learning from the models which were there, the Indian government should have stepped up testing, tracing, isolation with social distancing, and preventing all large super spreader gatherings. I repeat. So what has the central government and our honorable Prime Minister done in the last couple of months? He was busy in West Bengal addressing scores of election rallies with zeros. I mean, you can see the photo on the top, that's from a West Bengal election rally. And tell me if you can see even one person wearing a mask. I think we should give that person an award if they dared to wear a mask in the Prime Minister's rally. So when you have tens of thousands of people in each of such rallies, and you have dozens and dozens of such rallies going on, what is going to happen? But what is even more tragic, if it had not been comic, is the Kumbh Mela. The Kumbh Mela in Haridwar was last held in 2010. Now, as all of us know, the Kumbh Mela is held once in every 12 years. So how was it held this year? Maybe some of you might be knowing the answer. So actually, the government should have allowed the Kumbh Mela to take place on schedule next year. However, the government preponed the Kumbh Mela to 2021 because of political reasons, because Uttarakhand is going to have an election next year. And as a result, the BJP-ruled Uttarakhand government and the BJP-ruled central government actively promoted the Kumbh Mela, preponed it by 1 year, which is a criminal decision in my humble opinion. Over 31 lakh people attended on some of the days, like the Shahi Snan days. Now you can imagine if these kind of super spreader events are being actively promoted by the central government and the Prime Minister, are we not going to have a second wave? I mean, what more could have been done to bring out about the second wave? Then what about vaccination? Well, vaccination, the positive story is that, of course, we did get a vaccine available by the scientists and vaccine companies. And actually, by 1st of January, the vaccine was available. Serum Institute announced on 1st of January that 5 crore doses were available. And if we had started at that time giving vaccinations at the current level, which were until recently going on, that is about 30 lakh people being vaccinated every day, by 1st of May, the entire vulnerable population would have been vaccinated. But that was not done. When Serum Institute said and kept saying that we have vaccine doses available, please give us orders and start the vaccination and we will produce more. There was a huge delay. Finally, on 11th of January, the central government gave its first order of just 1.2 crore doses. Now remember, we had 35,000 crores in the budget. Yet only 1.2 crore doses were taken, which cost just 180 crores. So what is that 35,000 crores going to be used for? It's a big question mark. And why was there such a huge delay in initiating the vaccine campaign across the country, which led to a deceleration of vaccine production and supply? And now we are facing huge vaccine shortages because of this criminal neglect of vaccination. But again, the Prime Minister was busy in West Bengal. And so probably that was more important for him. Now, what about vaccine pricing? This is another peculiar conundrum. The same product is being offered to the central government for 150 rupees, the state governments for 400 to 600 rupees. Now it has been brought down a little bit by both the companies. And of course, in the private sector for even higher rates. Now, why should state governments purchase the vaccine at a much more expensive rate, something like double the rate of what the central government is paying? There is absolutely no logic. So what effectively will happen in this kind of situation is that they will be unable to procure adequate vaccine, and the entire blame for lower vaccination will be put on the state governments, and the central government will escape from its responsibility. And also the way in which sale to the private sector is being proposed may lead to a lot of black marketing, inflation of prices, etc., even more prolonging the epidemic, which is already claiming so many lives, as you know. And the vaccine has been crudely used as a political tool. And I think you mentioned about the Bihar election. So Biharis were told that if you vote for BJP, then you'll get the free vaccine. I mean, this is in the middle of the COVID pandemic, in the middle of the epidemic in India. So what about people who don't vote for BJP? Will they not get the free COVID vaccine? This is the first time as a public health expert in the last 35 years, I have heard of such statements that if you vote for us, you will get a public health measure, otherwise you are free to die. I do not know what can be more crude and completely violative of all public health principles, what this government has been doing. Now coming to oxygen. Given the first wave experiences, increased oxygen capacity could have been ensured and should have been ensured. But the central government, as you know, was busy doing other things. So they had no time for people and oxygen and patients and COVID and such minor things. So actually, 262 new oxygen plants were planned last year. But the approval was delayed so much by the central government that only 33 have been finally set up, of which only 5 are functional today. If those had been set up, there would have been a huge contribution to the availability of oxygen. More importantly, industrial oxygen was not accessed until a very late stage. And obviously, oxygen is something that you cannot just open the tap today and you start getting it in the hospital tomorrow. It has to be transported through tankers, in cylinders, and so many other logistical issues are also there. So because of this criminal neglect of preparing for oxygen supply by the central government, many states are today facing a huge crunch. In contrast, the Kerala government learned from the first wave, increased its medical oxygen capacity by 60%. So actually Kerala is now in a position to offer oxygen even to other neighboring states. So choking people, choking patients with lack of oxygen, this is, I think, one great performance of the central government. And now I'll tell you a story, which perhaps some of you know about. Haryana, as you know, borders on Delhi, And a lot of the oxygen supply for Delhi comes from various places in Haryana, especially Sonipat and Faridabad. Now, suddenly the Delhi government, various hospitals, they reported that the Haryana is ruled by the BJP, as you probably know. Haryana oxygen suppliers have been told by the state government to stop production. I repeat, state government of Haryana told at least six major oxygen producers to stop production. This is in the middle of the peak of the second wave of COVID. People started dying in Delhi. People started blaming the state government, and that was actually the objective. And this continued for 1 week. For 1 week, oxygen supply from Haryana plants to Delhi was obstructed by the chief minister of Haryana, and you know who was behind that. In fact, on off the record, some people said that they had gotten phones even from the home minister of this country to not supply oxygen, to not even produce oxygen for certain people. Now, what should we call this? We are all students of governance, uh, and we have a government in power which claims to be doing good governance. But I have a different kind of take on this. You know what happened in Germany in the 1930s? People died because of gas chambers. Millions of people died because of gas. Now people are dying for lack of gas. I think you got the hint. Now, what do we need to do? There are a whole range of issues, so I'm not going into details, but there are a lot of things which can be done and should be done, even in the current situation. Transmission can be reduced if social organizations, communities are engaged as equal partners, as has been done in certain parts of the country, including Kerala, even in some parts of Maharashtra. The entire experience of Dharavi was based on that. Even what is now being done in Nandurbar is another example of that. And well-designed health communication strategies are required. Lockdown is not the answer. A lockdown is an extremely crude and blunt instrument because it's like if you have a thorn in your foot, you can remove it with a needle or you can remove it with a sword. So if you try to remove a thorn with a sword, you know what's going to happen. So instead of lockdown, actually testing, tracking, treating, isolating, quarantining, these are the measures which are far more effective. And of course, some localized containment in high transmission areas would have been far more effective than lockdowns. All kinds of administrative hurdles are being posed to patients. If the person does not have a positive COVID report, test report, that even if all the symptoms and even if the X-ray and CT scan are showing COVID, hospitals are denying care, all kinds of, so there is a need to expand available beds even now. So roughly 60% of hospital beds in India are in the private sector. And out of about 19 lakh beds, there are about 7 lakh in the public health system and about 12 lakh in the private sector. So those many more beds can be insourced. I'm giving the example of Maharashtra, but it's a similar situation in other states also. Many more private hospital beds should be taken over. And of course, expansion of public health services remains a very high priority. Filling of vacant posts. In Maharashtra, 17,000 posts are vacant in the public health department since several years, but they've still not been filled even 1 year after the COVID epidemic. A lot of inflated demand for medicines like remdesivir and tocilizumab is also going on. And please note, remdesivir has no role scientifically in reducing mortality in COVID. I repeat, no role. There are global trials which have shown that well-conducted trials which have shown, like the Solidarity trial, that actually it only reduces hospital stay for a few days in some patients. But the way in which the demand has been exaggerated by private hospitals, and now people have also become scared and panicky, and they're running from pillar to post to get remdesivir, which is being black marketed at hugely inflated prices, similar for tocilizumab. And this is a failure of regulation of the private healthcare sector, which is now coming back to haunt us and showing that how important it was to have a much stronger public health systems and much better regulated private healthcare. And information, communication, and coordination are so critical in this epidemic. Public health is about involving the public, is about giving information to people, maintaining dashboards, displaying provisions in each and every hospital, having a high visibility and appealing campaign to encourage people to engage in appropriate behavior. Of course, people have also engaged in inappropriate behavior. But I mean, where is the governments and most states and at the central level are either missing in action or they just come and give a sermon once in a month, which is of absolutely no use. And of course, Corona coordination committees, which we have tried in some places and found to be quite effective. Again, even in Kerala, this has been done, involving panchayats, women self-help groups, volunteers on a large scale is the way to go to actually strengthen the efforts for control and also care for COVID patients. So I'll now conclude by saying that we need to develop a progressive political approach to the pandemic. We need this is a crisis of our system. It's a crisis of our health system. It's a crisis of our political system also, as I've tried to argue. And we can have a discussion on this, but it's the kind of politics which has been adopted by the central government is criminally negligence, and that is responsible for a large proportion of the avoidable deaths which we are seeing today. So therefore, we need to have a sharply political approach to this entire situation. And wherever possible, social organizations, social movements need to launch movements on various fronts. I'll just mention 3 fronts: ensuring right to health care for all now, massive strengthening of public health services, regulation of the private healthcare sector, and socializing healthcare like the NHS system. India needs an NHS type system, which is possible, a system for universal healthcare. We have enough resources, as I will come to very soon. And we must start working for this now. And combined with that, Corona recovery plans, I'll not go into this, just the last point, higher level of taxations on the super rich who have profited during the pandemic can support universal healthcare and the entire Corona recovery plan for other sectors like food security, agriculture, employment, social security, etc. This is the time for redistribution. Public health is all about redistribution. And India is a country which has, it's not a very poor country, it's a country which is simultaneously extremely rich people and many, many poor people. The wealth of Indian billionaires increased by 35% just during the lockdown period. India's top 100 billionaires would have seen their fortunes, they increased by rupees 13 lakh crores. Now, that is a number which we will not be able to count in our lifetime, probably. That is enough to have given each of the roughly 14 crore poorest people nearly 1 lakh rupee each. Mind you, only the increase in wealth. I'm not talking about the total wealth. Another gentleman who's well known and who is quite endeared to our Prime Minister and the other way around was making rupees 90 crores per hour throughout the pandemic. And entire 40 crore informal workers could have been pulled out of poverty if that amount had been donated or used. The top 11 billionaires of India, just the amount that was increased in their wealth could have supported our entire health ministry for the next 10 years. So the point is there is a huge amount of resources available, but it needs to be redistributed through progressive and direct taxation and corporate taxation. And finally, if there has been criminal negligence, then there needs to be punishment, and that needs to be political punishment. So I'm not again elaborating on this point. You are all quite senior and knowledgeable, socially oriented, professionals. But I mean, basically, the current government has lost all moral authority to continue in power. If there's any Modi Bhakt in this call, I apologize to them, but I would like to say that there needs to be a demand for punishment of the Prime Minister for the criminal negligence and appealing to people across India to not elect a single representative from this party in all coming elections, given the crime against humanity which we have witnessed, and no to criminal neglect of people's health, ensure health and social rights of people. And I would like to appeal to you finally to support ongoing initiatives. We need both kind of initiatives at Sati and Jan Arogya Abhiyan and Jan Swasthya Abhiyan. We're trying to do both things in a difficult situation. We have been carrying out a wide range of relief and healthcare support work, running help desks in rural hospitals, running helplines, training and supporting patient advocates in cities, and in various ways enabling people to access healthcare in a very difficult situation. You can definitely support this by volunteering and maybe even contributions. Jan Swasthya Abhiyan, the National People's Health Movement platform, is now developing a campaign on health rights now, demanding and proposing what all can be done still by the central and state governments. And a national day of action is being planned very soon, which you could also help by participating and propagating on the social media. And as Jan Arogya Abhiyan in Maharashtra, we are now planning to build a very powerful campaign as the COVID epidemic subsides, hopefully in the coming months, a campaign which will demand an NHS type system in Maharashtra, which will ensure that rich or poor, urban or rural, men or women or people from any background or gender, everybody will have a right to healthcare, and as a basic human right. So before COVID, this was the situation that we had. Topic was about public health systems and private sector. So until now in our country, profit logic, that big wrestler has been dominant. Against that big wrestler, there is a smaller wrestler who champions social logic in healthcare, which means that healthcare should be a basic human right. Unfortunately, till now, the small wrestler has been, overwhelmed by the bigger wrestler. So the change we need is very simple. It's very easy to understand. This is the change we need to see. The social logic must become dominant in the entire healthcare sector, and the profit logic must become controlled and regulated. And we now don't need a return to the old, inequitable, privatized, exploitative, and negligent health system. We need a renewal to a better system. And I conclude with Arundhati Roy, who says that the pandemic can become a portal. We don't just want a return to normality. We want to move forward. We should think about moving forward. It's an opportunity to reimagine and rethink about what kind of health system we have had in this country until now. And do we want to go back to the same kind of health system, or do we want to have a much better, not just health system, but also a better society, better public systems, and part of reimagining a better world, which we will need to fight for, because it's not going to be simple. But we should all, learn from this pandemic and really think anew for working in this direction. Thank you.
Thank you, sir, for sharing your insights. I mean, I personally felt very deeply evoked, especially with the different numbers that you shared and the hidden realities that you shared as well. It helped me understand different sides of what is happening with respect to crisis management in our country. And I also strongly believe that universal healthcare is surely a way to go forward, and I strongly advocate and agree that basic human healthcare is definitely a human right. Right. On that note, I would like to invite participants in this call to share their thoughts and questions in the chat, and we can have a discussion going forward. Yeah. So there is a question from Shiraz. What is the quantum of vaccines that the central government is cornering? What is the transparency regarding distribution?
Okay. See, what I had mentioned is that the central government has made a mess, a politicized mess of vaccine production, procurement, and distribution. And that's why we've landed up in a situation where now there is actually a genuine shortage of vaccine, besides maldistribution. So as I mentioned that if in January itself, Serum Institute and Bharat Biotech had been given larger advance orders, much larger advance orders, which was eminently possible, then we would have had adequate, vaccines available. This is not rocket science. There are population figures which are well known, and each state's population is well known. The vulnerable populations are well known, the numbers. So roughly 30 crore people need to be vaccinated in the first wave, which means 60 crore doses. And with some stepping up of vaccine production, Serum Institute and Bharat Biotech could have fulfilled this. So actually there is no, in my opinion, the main problem is not vaccine production. The main problem is the policy regarding its distribution, both its procurement and its distribution. So yeah, I think that's just a brief answer. There's another question about Delhi not having a backup plan. Yeah, I suppose so. Actually, see, vaccine oxygen is something which is not very easy to transport. It's not like electricity and all. I mean, it's a it's a liquid which has to be maintained at a certain pressure in cylinders or in tankers, and it's so what actually Delhi government probably should have done after the first wave, and Delhi had a significant first wave, was also to set up or promote oxygen plants within larger hospitals in Delhi itself. Delhi, unfortunately, pardon me, I've also lived in Delhi, but it's a parasitic city. Delhi doesn't Delhi doesn't produce much, and it consumes a lot more than it produces. So, given that reality, at least it should have made arrangements with various state governments, including states like Rajasthan or Punjab or so on, which might have been politically more friendly to it, to be on standby to provide oxygen. But this was not done, and then it's surrounded by Haryana and UP, and you know what is going on in both those states. So, and to get oxygen from Odisha or from some other state is going to be much more difficult at the last moment. So, yeah, that's just briefly.
We also have some raised hands. Shyam, Praveen. So if it's okay, maybe we can take 2-3 questions together.
Yeah.
Would you?
We have only Praveen who has raised his hand. Praveen, do you
There's
have
something about vaccination of homeless persons in Mumbai. So, yeah, I think please get in touch with the Jan Swasthya Abhiyan Mumbai group. They are already working on this issue, and probably they can collaborate with you or definitely actively support a PIL or something of that kind which you have mentioned. Definitely.
Shyam, I'm just going to unmute you. Would you like to please present your question?
Good evening, sir. Thank you so much for your time. My question is about even around the time of the passage of the previous act, there have been rumors about oligarchies, medical oligarchies in the healthcare sector, who are controlling the reins of political power with their wealth and preventing the passage of acts which will allow for the healthcare system to be put in the public domain and remain in the control of the private domain. My question to you, sir, is that have you had experiences of this sort with such oligarchies? And also, you spoke about the redistribution of wealth. I was wondering how we can ensure this dispersion of power so that there is less corrupt influence towards public healthcare. Thank you.
Yeah, both are big questions. You see, the medical lobby, the private medical lobby in our country is, of course, hugely powerful. And there are two special reasons for that, besides being like any other industry. One is that all politicians, even though they don't have hearts, but they have cardiologists, they need cardiologists. There are influential private sector doctors who strongly lobby with and influence not only through their medical expertise, but also through huge amounts of money. Any party which is in power, almost any party. So they are very influential financially as well as socially. And the second reason is that they are quite well organized and they operate as a powerful lobby, and they tend to block any kind of regulation. So There are many examples of this. I'll tell you just one example from our own experience. As Sathi, we had brought out on a report on unethical practices by the pharmaceutical industry. And in that, we basically showed how private big pharma companies are bribing doctors day and night. And doctors are happily accepting those bribes in return for prescription of a lot of irrational and expensive medicines. You can understand how it goes on. It's pretty common sense. And in the report, we interviewed 40 medical representatives and marketing people from the pharma industry itself. So this is not outsiders. These are whistleblowers from within the industry who know day and night what is going on because they are at the front line. And they told us about absolutely horrifying incidents. I'll not tell you all of those, but one small part of that was doctors regularly being supplied with women in exchange for prescribing irrational and expensive medications. This came out in the report. And after that, the entire private healthcare lobby, it started sending threatening phone calls. They started threatening my colleague, Dr. Arun Gadre, who was involved in that report. And they tried to get him deregistered from the Medical Council of Maharashtra and all kinds of things. And, this is the kind, so they are absolutely unscrupulous. And anyway, you had a second question also? Maybe we'll come back.
I was just speaking about since you're actively campaigning on this, how we can campaign or how we can prevent this centralization of power. Yeah, disperse this power.
So that's a huge question. I think probably we don't have time to talk about that. But
all right, thank you, sir.
Yeah, but I mean, just historically, if you see, why did the NHS come into being? It's a huge redistributive program. So the organized social movements, not just of some healthcare professionals or some health activists, but large-scale organized social movements have to be built up, which will demand this kind of redistribution. That's the only way that historically large-scale redistribution takes place in society. That's very briefly.
Thank you, sir. Would you like to listen to some few questions and answer them at a time, or would you want to take questions one by one?
There's one more question in the chat box from Charu Govindan. So he's asking about criminal blockage of oxygen by Haryana government. This is so disgusting. How can we expose and bring them under justice legally? So ideally, there should be an investigation as to why a large number of oxygen plants suddenly in Haryana suddenly stopped producing oxygen for almost a week. I mean, this cannot be in the middle of the peak of the epidemic. I think that there should be an investigation into that. And I would like to put on record here as an idea, can we organize a public tribunal on the Modi government, its conduct during the COVID epidemic? This is something which needs to be done. You see, we should not allow these crimes to go unnoticed or unpunished. And the government is not going to do that. But I think, including this Haryana incident, which is there. So, I mean, crores of people will not know about this. Probably many of you also might not have known about this. These need to be visibilized. These need to be brought on the political plane. I think that is something that, all of us need to think about. Vasundhara has sent a set of questions.
Sir, some have also raised their hands. I'm not sure if you would like to listen to the question.
Okay.
Listen to the questions, and so we can answer them.
Okay.
Yeah. Praveen, I think you've been waiting. So would you like to say a question? You can unmute yourself.
Yeah. Good evening, sir. Right, it was a great lecture, sir. Your session, it was great. Right, you have rightly pointed out the mistakes of the central government, but I think the state governments are also equally responsible. They had 6 months of time after the first wave of the COVID pandemic. They could have set right simple like a helpline number, creating a dashboard where the number of ICU beds, health facilities which are there, right? These kind of things doesn't require much investment. And most of the states were also in the elections, right? Political rallies, everybody, all parties, material of national or state parties, all parties were participating in the rally. and also election commission to an extent actually is responsible for this thing, right? Throwing all the COVID protocols to wind, right? Madras High Court also has quoted that EC has been a failure in this regard. And also how much the citizens as such, right? We also showed a basic lack of civic sense, right? Abusing the purpose of mask, right? Wearing it everywhere except where it is actually designed, right? For covering right, nose and mouth, right? We abused it. We were going for religious things. People were going for it. Couldn't people apply their common sense, right? I'm not talking about people from the poorer sections of the society, but middle class and upper middle class, right? Who are well educated, right? Applying the basic civic sense is what I'm talking about. If you are asking for a setting up of a tribunal for the central government, shouldn't these state governments, where the public health is actually a state subject, they are more responsible? And what about the people who have been part of the super spreading events, like religious events, right, right, taking place in that, which has actually resulted in the mutation of the virus? Shouldn't also they also be brought under the book? So these are my few.
Thank you, Praveen. I'm just going to pass on the mic to Simran. I'm just going by the order of which who has raised hands first. So, Simran,
yeah, thank you, Aishwarya. Hi, sir. This is Simran Grover joining from Jaipur. I work on electricity governance issues, especially in the state of Rajasthan. My first question is, even in the electricity sector, we are seeing a push for privatization, and what we often see is that low-hanging, safe investments is what private sectors companies get attracted to, mainly metropolitan cities, and then tier 1 cities, maybe the tier 2 cities, if they have the capacity to they take the risk. We are far away from seeing any improvement in quality of supply and services to the rural sector, and I think same thing applies in my humble opinion. I think I see many contrasts even in healthcare sector. And when we say, when there's a push for privatization, there's always this argument of, we can invite investments and hence the infrastructure quality of services will grow. So my first question to you is, is there a room for private sector to be, or should it be there? And if it's there, then what are the value principles on which the sector needs to be regulated? That's one. Second question is, I think most of our politicians, of course, don't have the humility to admit that we are not the experts. And I want you to, share with us your understanding. What is the role of institutions? What are the institutions that we need to invest in, and how these? I mean, we obviously see degradation of institutions, handing over to consultants, etc. So you can share, how if you can share also how these institutions then have evolved in last decade or two.
Thanks a lot, Simran. Sangeeta, do you want to? You can unmute yourself. Do you want to say your question?
Yeah, hi sir. Thank you for the presentation. So I'm Dr. Sangeeta. I'm working in a tribal area in Tamil Nadu. And honestly, it has been a year and we are still waiting for proper COVID testing here. The situation is kind of bad in the second wave because we have started seeing cases, but the whole idea of COVID won't reach rural area is like a proper myth. Like people actually believe in it. And even when this whole center versus state fight is happening, it is mostly about the urban areas, and rural areas are grossly missed out. And though they say Tamil Nadu is good in healthcare, and that also has a lot of issues for that statement, even we are also badly left out when it comes to rural areas. So it is, there's also a tribal population. It's more vulnerable. We are seeing the COVID waves hitting us, but we don't even have testing to do. The nearest testing is 90 kilometers away. And we can't we can't store oxygen because cities are already running out of oxygen. And from a rural perspective, how this crisis is handled, and in this whole center versus state fight, this rural area is even part of the issue for people, like for the people who are managing it. That's my basic question, sir.
Should I respond now? Because
there are two more people who have raised their hands. Do you want to listen to theirs, or should
I think I'll respond, because otherwise I'll lose track of the questions.
Yeah, no problem. Sure.
And they're all quite significant questions.
Yes.
So Praveen has asked about what is the role of state government, what is the role of ordinary people. It's a correct point. And I'm not in any way saying that the state governments are, have not been guilty. They have their share of responsibility in many ways. We work in Maharashtra, and I can tell you that the Maharashtra government could have done many things better. And of course, people themselves have also contributed in many ways, which you have also mentioned. But what is the role of political leadership? And it is said that a fish starts rotting from its head. The role of political leaders, and how did other countries manage it? How did China manage this? How did South Korea manage? How did New Zealand manage? How did Japan manage? We need to look at the role of political leadership. And in this kind of a crisis, national political leadership, their role is critical. And if the national political leadership applies itself to the situation effectively, which did not happen, as I have tried to argue, then state governments can also be strongly brought on board. But actually, the reverse happened, because the national leadership was completely irresponsible and haphazard in its actions. Lockdown laga do. Ya to kuch mat karo, ya lockdown laga do. I mean, whereas many other things could have been done. So state governments also were in a state of confusion. And they also had their own share of bureaucratism and insensitivity and so on, which contributed. But I would place number one onus on the central government, number two on, of course, state governments also, with Kerala as an exception. Unfortunately, even Kerala did see a subsequent some rise in cases. So I'm not saying things were absolutely fine in Kerala, but still, on the whole, it was contained better. The death rates in Kerala are something like 1/4 of what they are in Maharashtra. The number of COVID patients per 100 who are dying, it's 0.37% in Kerala. It's about 1.5% in Maharashtra. So, this tells us something. There is a difference. And people respond to socio-political leadership and messaging. If, our Prime Minister said, no Kumbh Mela this year, it would have been given a huge message, that, being Hindu doesn't mean that you have to go and crowd in Haridwar and get exposed to the COVID virus. So that messaging was missing. Did you hear that messaging in his speech? Don't go to Kumbh Mela. I heard his speech, his recent speech. Did you hear anything saying that, don't come for political rallies? We should avoid political rallies? I didn't hear that. I mean, you're talking on prime time to crores of people. Where is your messaging? The key messages are missing. And you're just giving some vague things, I am very concerned and let's do something together, blah, blah, blah. So I think that, there is responsibility at various levels, but the central government is clearly has a most important responsibility, which has been not, fulfilled. Simran had asked about, is there a room for the private sector? What are the principles for evolving the private sector? Role of institutions? Again, big questions. We don't have much time. Yes, India already has a huge number of private healthcare providers. 60% of our hospital beds are in private hospitals. So we have to involve them. And not all private hospitals are totally exploitative. There's a range, there is a spectrum. And here we've done a study on corporatization of healthcare, which shows that the more and more you corporatize healthcare, the less and less it becomes socially accountable. And overcharging, all kinds of malpractices increase with corporatization. So what we need is the opposite of corporatization, which is comprehensive social regulation and bringing the smaller and medium-sized providers, individual practitioners under a public umbrella. Instead of the corporate magnet, the state and society should act as a counter magnet and say, come in the UHC system, you'll be paid well, you'll get a decent return, no super profiteering, no exploitative care. But yes, your doctors, nurses will get a good, decent wage, complete job security, like it is there in the NHS, but no super profiteering, no profiteering. And, then we can win over large sections of the private sector to a rational, universal healthcare system. I think that is the direction to go. There are various principles there that instead of using public resources to subsidize private providers, we use private resources to strengthen public system. These are two opposite approaches. Current PPPs usually subsidize private providers in a way that they flourish instead of the public system getting strengthened. We have to do the opposite. So we call that insourcing of private care. So you bring in a private provider, a specialist doctor or a hospital into a public network so that it strengthens the public system rather than the other way around. There are many other issues, but I am not going to those right now. Institutions. Can you tell me, any of you, our leading institution in public health in this country? You have to think a lot.
I suppose it's ICMR.
ICMR is not public health, sorry. It's the Indian Council of Medical Research. Its primary task is medical research. It's not public health. They have now sort of branched into public health, to a certain extent. It's not dedicated to public health. ICMR primarily guides centers, research studies across the country to medical research, which is not public health. We do not have a proper national public health institution dedicated to public health. Is this not a failure 70 years after independence? Is public health not important? You have National Institutes of Health in the US. You have comparable institutions in many other countries, but we don't even have a national public health institution of that caliber. There are institutions which have a name of public health with them. There's one in Kolkata, there are a few others, but so we don't have that kind of institutional capacity also at that level. But so then AIMS becomes the director of AIMS. He's not a public health specialist, sorry. I have full respect for him. But so they have to step in because there's a gap, or ICMR has to step into the gap. But that is not the solution. We need to strengthen public health capacity in all states. Where's the public health institution in Maharashtra? Tell me. Tell me the name of which public health institution is there in the government sector in Maharashtra, which is dedicated to public health. Actually, on paper, there is one, but it's nowhere in the picture. So this is the failure of institutional capacity also, which needs to be strengthened. Sangeeta has asked, we are still waiting for testing. Yeah, rural areas is a very important issue. We could talk in great detail. In Maharashtra, as Jan Arogya Abhiyan, we have tried to develop a separate program of action for rural areas in the COVID period. And it's a 10-point program which we've written to the health minister. Rural areas are affected and they are going to be affected. Unfortunately, even more affected. And they need special attention. And there are a range of things which can be done in rural areas. I'm not going into all the details. There is social capital. There are communities. There are panchayats. There are various kinds of rural organizations, social organizations, which need to be brought on board. Decentralization of capacities, setting up COVID care centers for milder patients, setting up isolation and quarantine facilities at the local level, ensuring proper transport facilities. Not everything can be done in rural areas, but many things can be done, even without specialist doctors. So all those things should be done so that only some patients who are really critical have to be taken to the cities or larger centers, and 90% of patients can be managed within the block through proper management with the existing resources, which is probably not being done adequately at this point of time. I think there are many other points which I'm not going to.
Thank you so much, sir. Aditi, would you like to also right now ask your question here?
Yes, please. Hi, sir. Thank you so much for that session. I'm a journalist and writer based in Goa, and I wanted to address another thing which has come to light recently, which is the clampdown of the BJP IT cell on those citizens who are trying to step up and fill the gaps that the failure in governance has left. And it's really appalled. Many of these are my friends in Delhi, and they are getting threatening calls from people who claim to be the police. So I think recently activist Saket Gokhale moved the Allahabad High Court and to restrain the UP government, right? From taking coercive action against citizens, but for those who are appealing for oxygen on social media. But what can we do in other states to counter these kind of monstrous acts of oppression?
Yeah, again, a big topic. You see, you saw one of my slides which showed two gentlemen, one from the 1930s and one from today.
Yeah.
Fascism and neo-fascism are
Yes,
not
but
just a problem with the state. It has roots in society. And people on large scale are misled, manipulated, and viciously, mobilized in a very perverse manner. And that is, what we are seeing today. So it's not just the governments are obviously responsible and doing things. So we have to set up a counter social movement of a certain kind, which will expose these kind of things. So we should use legal and constitutional tools, yes. But I think sometimes we get stuck in legalism alone, which is not sufficient. We also need to mobilize citizens, and if they can do it, you know what I'm talking about. If it is done in a negative and perverse way, we also have to have this, because the truth is on our side. And there are so many. My short presentation gave you, I think, enough material to convince any sane-minded person that something is going wrong and something has gone wrong. So we also need to reach out to far more number of people beyond our circle of converted. We have to talk to middle-class people. We have to talk to students. We have to talk to ordinary people in our societies and communities, and also tell them what is going on in a more effective way. I think there's a huge role for that. Besides, of course, going to cohort. I'm a member of the NHRC core group on health, and we are issuing a set of advisories which will come out probably by day after tomorrow or by Monday, in which we have taken up this point which you have talked about, that no person should be harassed because they have made a complaint regarding lack of oxygen or any other facility. We know what's going on in it's
Right.
criminal. You
Sir,
commit
but
one crime.
Right. And I'm actually talking about the volunteers who are trying to disseminate information and help others. Those are the people who are being threatened, and these are kids under 25, who are starting off in their careers.
We need to publicize this much more, like you're telling me and I'm telling you. We need to form a much broader alliance of all progressive democratic forces, wherever we are, so that we become a very visible voice. What happens is individual voices can be suppressed, unfortunately, to some extent. But if it becomes so large that it cannot be ignored, like the farmers movement, for example, and then it'll go to a different scale. So we'll have to find some strategies to expand in that way also. Anyway,
Right.
that's a big topic, but
One more question, sir. I wanted to ask about.
Aditi, we are running a little bit out of time.
Okay.
I am sure we all have a lot of questions. It's okay to go back with some, because there is so much journey ahead. While Dr. Abhay Shukla has been kind enough to spare us his time. Abhijit, you had a few remarks. Maybe you can share the questions with us. We will surely pass on to Dr. Abhay. And
Good evening, sir. I think more than a question, and I want to share what I'm feeling right now. And after listening to you, and after you, I think especially when you spoke about the Haryana incident, I feel disgusting. That's what I feel. I feel cheated as a citizen. I feel disgusting. I feel morally compelled to go on the roads and shout right now. And I don't know what is stopping me right now to just leave the call and go outside and shout and tell people that we are being cheated by a vile, corrupted, and also a criminal-minded people. Till today, I am a student of Barefoot Academy from last 3 years, sir. Till today, I used to know there is good governance and bad governance. Today, I'm taking a word which is called as criminal governance. It is not bad governance or good governance, it is criminal governance. And my question, not only to you, sir, to the lot of young people who have joined this call and who have been observing this call, listening, and I'm pretty sure they'll also move from you and listening to you and others, is that how is it not a mockery we will do on ourselves to visualize a caring and compassionate governance when there are leadership who are doing crime in front of us? Like last Wednesday, we had an opportunity to hear Mr. Harsh Mandar, who quoted Arundhati Roy and said, COVID is an X-ray. Today you said COVID is a wake-up call. I feel the X-ray is done. I feel the wake-up call is done. They know it. They are seeing it. They're intentionally moving their eyes away. It would have been good if they would have not done anything. But I think they are doing something which is damaging us. So how is it not a romantic idea? And this is a question to everyone I'm putting. Is it not a romantic idea to think that we will fix the healthcare system and public healthcare system somehow without even visualizing how to bring a political change, how to bring a change in the entire political consciousness of how do we govern and how do we throw away this kind of leadership which is killing people in the name of governing them, in the name of good governance. The audacity I don't understand, and we are consuming it day by day. And I'm sometimes little bit moved, a little bit when someone is asked whom to blame. So should I blame the state government? Should I blame the central government? I'm saying, where are we looking? Are we not seeing the intention? And I used to always say in my work, अगर गंगोत्री साफ है तो गंगा साफ रहेगा. यहाँ तो गंगोत्री में गंदगी है, वो कौन साफ करेगा? And this is a question to everyone. What step are we going to take? We have reached to the place when there are queues of dead bodies. Are you able to sleep by looking at it? I am not. I am putting it right here.
So Abhijit, I fully share your anguish, and in my presentation, actually the last few slides were about politics. And public health cannot be either viewed or changed without political change. So I'm 100% clear, and I tried to convey that also, that we need to make public health into a political issue, and we also need to engage with the larger politics of the governance in this country. It's not going to happen in isolation. But let me just remind you of two things. Firstly, fascism and neo-fascism has always been defeated by people. The gentleman in the United States. I mean, if you're talking using the words, adjectives like vile and criminal, what happened, in the elections in the United States. So people also, the same people who had elected him 4 years back, they realized, at least a large chunk of people, about half of the people, realized, a little more than half, कि यार ये तो नहीं चलने वाला. Anti-CA NRC movement in early 2020, farmers movement in late 2020, early 2021 are two waves. Wave सिर्फ कोविड का नहीं होगा, wave जनता का भी हो सकता है. My prediction, or at least hope, is there will be a third wave of people's upsurge, which will follow the COVID epidemic. We should try to build that wave. And we should try to ensure that in state after state, what I said in my presentation, not a single person is elected from this party to any position of power. We should, and that is why I'm saying we should have tribunals, we should have large-scale public awareness campaigns, and we should go to people who are unconverted, not just our usual circles. हम लोग तो सब इस कॉल में converted हैं, हमको पता है क्या है. But there are crores of people, and in our own contact, there are hundreds of people. We have to have much more effective tools of reaching out to them and saying, boss, ये चल रहा है, चलेगा क्या आपको? या कुछ करने की जरूरत है? And if we are able to put a credible alternative on the table, and this is my last point, a credible political alternative is required. The problem is, what the problem is. So for that, as I see that today in Maharashtra, a huge range of left progressive trade unions, Kisan Andolans, mass organizations have come together on a common platform called Jan Andolan Sangharsha Samiti. And we are taking up a program from now until 2024. Similarly, we need to build up these kind of broad platforms. And also young professionals, intellectuals, social activists need to, network better with each other. Because otherwise your anguish will remain an individual anguish. Which is a good starting point. My salute to you for that, but it's not sufficient. Your anguish has to become the anguish of thousands of people, of tens of thousands of other people. Then it will lead to change. I'm telling you, it will lead to change. But we'll all have to, get down to doing that together. And we'll have to set apart our differences. Of course, we'll have differences. Even in a group of 3 people, you'll have some differences. We're talking about 130 crore people. So, but we'll have to put apart our differences and build that kind of wide solidarity, which has always defeated fascism. आपने नारा सुना होगा, जो हिटलर की चाल चलेगा, you can complete the sentence. It can be done, and I am confident that it will happen. The anti-CA NRC movement and the Kisan Andolan have shown us that people in this country can stand up, but now it needs to be done in a much more organized way. So are we going to wind up now? Or?
Yes. Well, thank you so much to both Ms. Abhay Shukla and participants, including Jasjeet. Thank you so much for coming in to share your reflections, your questions, because this isn't a conversation that's also too distant from our daily reality. And sir, Mr. Abhay Shukla, thank you, because your presentation was not just powerful in pointing out how grave this crisis is, but in how this governments, both central and state, has been choking people with this criminal negligence, and how the media, the state, and a huge part of the rich sections of society has been complicit in the acceleration of this pandemic. And Justice, I really want to thank you as well, because for you to just share your personal experience with us, to point out that healthcare is a fundamental right to people, and it's not something that is coming out of a philanthropic gesture. It's not a charity, but it's a fundamental right to people in the world. And with your personal experience, thank you for sharing us how NHS works, and thank you, sir, Abhay Shukla, sir, for connecting the dots to to how India has reached this stage today. And despite the epidemiological evidence we had in the first wave, all the warning marks we had in the first wave, to prepare not just for oxygen plants, for hospital beds, for health infrastructure, and a more equitable distribution of this COVID relief or COVID response from our both central and state governments. Um, I'm also coming from a place of real personal anguish that Abhijit also shared, that because this is a reality, a lived reality of all of us, when we open our newspapers every day, when we open our social media every day. This is not something that is less reported. COVID and COVID deaths and negligence of the government has been widely and quite maybe not by the mainstream media, but we have all been facing either on a personal level or in through social media, through our friend circles, through our networks, how there is a real shortage that is being denied, how there is a dishonesty of our governments in place. And I think that, I mean, it isn't fair to conclude this while without saying that we're not participating in this session of Samvaad just just as an educational experience. It's also a very, very personal experience, because till now, every day, almost every alternate day, I get a WhatsApp message on one of my groups that someone we know or someone who knows someone has passed away and is survived by families, is survived by children, and we are not in a position to turn a blind eye against this, like our governments. So thank you so much, sir. This has been a real.
I'd just like to conclude with two appeals.
Yes.
Number one, if you feel that my presentation was useful, I am willing to make this presentation to any other network which you are part of and where you feel it can be useful. Just let me know in advance. I mean, this is a top priority for us now. I'll keep other things aside and talk with any other group of your friends, fellow activists from any other state, any other part of the country. I am available. So you are welcome to get in touch with me. And if for some reason I am not available, my other colleagues will definitely join you. And I will personally treat this as a priority. My phone number is there with Hema. Hema, you can share it with others. And secondly, the National Day of Action on 10th of May. Those of you who are active on social media, at least try to propagate the messages that we will be putting out on right to health now. And governments take responsibility, save people's lives, and ensure people's health. If you can help in that, that would be a great contribution. And please do stay in touch and also reach out to others.
Thank you. Thank you so much, sir. I speak on behalf of everyone here to say that we're really grateful for this offer. Plus, I just want to mention that people who want to share this presentation or this Samvaad, including the questions, including Romila's powerful introduction, we have this on our Facebook page as well. I've shared the link on the chat. So the live stream is available to be shared with anyone who's interested. Plus Hema, I think we can email all our registered participants Mr. Abhay Shukla's contact details and offer what he has offered here. Thank you, sir. Thank you so much.
Okay.
Yes. I think this would be a good time to wrap up. There are some offers. There are some people who have offered for either for interested people to volunteer or those who want to be contacted with Jan Swasthya Abhiyan. There are a lot of people who have. Please look at the chat once. We will share some of these important details on mail as well. But yes, so thank
Okay.
you.
Thanks
Thank
a
you,
lot.
everybody.
Okay.
Thank you
Bye.
for participants as well.